The war in Ukraine has raged on for more than a year. Civilians transforming to soldiers, defending their country and freedoms against Russian forces. A key piece of this resistance is the doctors and nurses caring for the wounded and the sick. Local 5's Mary Sugden sat down with 5 of these frontline workers and joins us with their story.
Stephanie, this team of physicians spent the past week here in Des Moines collaborating with local healthcare leaders to learn best practices. I sat down with them to learn what they've absorbed in their first U.S. experience. Well, I know it's been a small time that you've been in the health system in the U.S. Anything that stands out that you were surprised to see is the U.S.'s way of doing things in medicine?
As a specialist in primary care, I know I was very much impressed with the local walk-in clinics and the level and the depth of care that they provide to the people on that level. I'm very much impressed with the system of medical insurance here. That's something to definitely take into consideration upon return to Ukraine. This connection between federal, state, Medicare, Medicaid, and their cooperation for the benefit of the patient. I was impressed that there is no segregation in providing care. Undocumented immigrants receive the same level of care as the citizens of this country. As an example, a pregnant woman will always receive help and medical care regardless whether she is documented, can pay or cannot pay for the service.
I know this is a first trip to the U.S., so talk to me about what your impressions have been, anything that surprises you about our country.
The first thing that impressed us was the local hospitality. People everywhere are amazing in their attempts to help. They smile often, they're very friendly. We are pleasantly impressed how much they know about Ukraine and how much they dedicate to support Ukraine. We witness people who come to us with tears on their eyes, continuously asking what else they can do to help our cause.
And that was a very small piece of the nearly 1-hour discussion I had with these doctors. Next week, we'll show you part 2. It's an emotional and raw conversation about the realities of wartime and the unimaginable scenes these doctors face. Here's just one of those stories.
The enemy seem to act to destroy civic objects that have nothing to do with military or support of the military. And so we have unusual examples when schools are bombed, hospitals are bombed in her city of Kramatorsk, an object that, again, only serves civilians.
Again, tune in for that full conversation next week.